So since starting to do these videos, I've gotten a lot of requests from people about how they can find a chiropractic office like ours. So if you already have a chiropractor and he or she gets you in once a month, cracks your back, does stim or ultrasound or heat on your back or puts you on a traction table, and you'll love it, that's fine. This video is not intended for you, so don't flood the comments with how great your chiropractor is, even though he does all these things I'm going to talk about that you should avoid. That's fine. I'm talking to people who are looking for a chiropractor who is about what we have been talking about in these videos, removing interference from the nervous system, allowing that person's body to heal and function naturally on its own from the inside out, not trying to change it from the outside in. Okay, so if you are looking for something else and you have it and you're happy with it, God bless you. I'm trying to help these people who are looking for something like what we do. And I've come up with a few kind of red flags and green flags that would indicate that, if you're looking around online at websites or calling around or talking to friends, things to look out for that could help steer you. So the very first thing, and maybe my absolute trump card, like the one non-negotiable thing for me, is that they take imaging unless there's a very serious reason not to. All right. If they're not taking images, at the end of the day, they're guessing, okay? And we do not want to guess with your health. There are a lot of chiropractors who say they can feel what's going on. There are things called static and motion palpation, where they're either feeling for misalignments or feeling for unusual movement or motion in your spine. That's really not reliable at all. There's a lot of studies that have been done on this. The ability of chiropractors to actually feel around in there. These misalignments that we're dealing with are very small, smaller a lot of times than the irregularities and asymmetries in the bones of your spine. Things can be feeling like they're shifted one way significantly, but it's just the way a bone is shaped, or it feels like it's moving incorrectly, but it's just the way the joints are shaped at that particular segment, which you wouldn't know about at all unless you just took some pictures. It takes 10 minutes tops to get pictures. Here at our office, it takes 25 seconds to get an accurate set of 3D images on a person. The chiropractor really should be doing that. So that's thing number one. You don't want to guess with your care, with your health, with your body. You want to see what's going on. The second thing is that they use the term subluxation, or at least refer to the concept of it. And all of our new patients, it's just described and discussed right in our new patient intake paperwork what a subluxation is, the fact that that's what we're dealing with. They watch a quick 5-minute video kind of breaking down and detailing what a subluxation is. And then even if the word is not thrown around constantly after that, the concept, the idea is there. What is a subluxation? That is a misalignment in the spine, which is causing interference in the nervous system. And both of those things need to be measurable. A measurable misalignment causing measurable interference in the nervous system through some kind of instrumentation, some kind of test, something, okay? So very important. Again, otherwise, we don't really know what they're doing or what their goals are. The third thing is to make sure that they don't run a retail shop, okay? If you go onto their website and you see they're selling pillows and supplements and custom orthotics and all these things, okay, that's great, but now they're stepping outside of this principle that we're discussing. If they're telling you that you need to take ground up bovine adrenal glands that are in a capsule, however many times a day, they are not removing interference anymore in your body's ability to function and heal. They're trying to tell your body how they think it should be running from the outside in, from manipulating it from the outside in. And that's not what this form of chiropractic we've been discussing in these videos is all about at all. Now, don't get me wrong. Those things may well have their time and their place within some other clinical setting. They can be absolutely beneficial for people when they're in a certain state, when they've gotten to a certain point in their health, a certain negative point in their health. But for a chiropractor, to be working with the principles of chiropractic, these fundamental ideas that we deal in every day, it doesn't compute. It doesn't add up to what we're trying to do. The fourth thing is probably one of the most overlooked concepts by chiropractors generally, which is knowing when not to adjust a person. Now, I don't mean someone coming in and they took x-rays and they saw they have a broken neck and they know not to touch it. I mean, they've been working on a person, trying to correct the alignment in that person's spine, remove the subluxations, get the nervous system to become integral again and intact and communicating. And in the process of that, see that they're achieving that result, and that person comes in and they not need to be adjusted that day. It's the same as a dental patient who's been brushing their teeth for the last 6 months since their last cleaning, and they don't find any cavities. Well, they don't have to drill that day. Everything is fine. It should be that way in your chiropractor's office too. They should know when not to adjust you. And how is that? Well, they're going to know through some kind of objective, measurable testing, not asking you how you're feeling, not a scale of 1 to 10 and all this other nonsense. They should be able to look and see and measure something. Here in our office, with every patient, more or less, at every visit, before and after being adjusted, we do infrared thermographic nerve scans. We do neurological postural assessment on all of our patients to see how their nervous system's functioning, if there's dysfunction, breakdown in communication from brain to body like when we first met them, or if things are communicating well because of their most recent adjustments, things are open and clear, working properly, in which case they don't need to be adjusted. We leave those parts of their body alone. We can't improve upon perfection. All I can do at that point is, mess them up by moving things that don't need to be moved. So very important that you find a chiropractor who has some very clear measures for determining if and when and where you need to be adjusted. And the final big thing is that they don't have this buffet of modalities, this large menu of things that they do, ultrasound, electrostim, traction tables, a bunch of soft tissue modalities, all of these things that are something other than adjusting the spine to remove subluxations, to free up that flow of nerve information to the body so it can function correctly. Those are all, that's all physical therapy. And that's fine. Again, there's a time and a place for all of that stuff for many people, depending on where they're at in their health. But it's not the job of a chiropractor. It'd be like going into a chiropractor and having him decide to clean your teeth or to, do colonic irrigation and clean you out. Okay, those things may all have their place, but not for a chiropractor. If my wife came home from a chiropractic appointment and said she had any of those things done, I'd be calling up that chiropractor immediately to be like, what are you doing? So I'm not saying that, they do these things because they can't adjust well. I think maybe that is the case. A lot of the times they can't get the results that they really are looking for with a chiropractic adjustment, maybe because they're not taking pictures, maybe because they're not doing any kind of pre and post testing. But these things are ultimately, again, trying to force your body to work a certain way or treat symptoms from the outside in, rather than freeing up your body's natural ability to heal. One last thing. In our office, we utilize a form of chiropractic called upper cervical chiropractic. We have videos on this as well. You can look through our video history. And I would say generally, looking for one of these offices is a good place to start. Now, you may run into the fact that even though they do upper cervical chiropractic, they're still doing all these other weird things too that have nothing to do really with chiropractic. They're trying to treat conditions and quiet down symptoms kind of artificially from the outside in, rather than allowing the body to do that. So you do need to kind of scour their websites and look and see. But even simpler, if you want, feel free to reach out to our office. We're happy to help you find a good chiropractor. We guide people all the time. Our patients have family, our friends that don't live here in our immediate vicinity. They're across the country or on the other side of the world. And there are chiropractors there, and we're happy to help them find a good match, someone who's going to take good care of them. So our website's listed in the description of every one of our videos. Just hop on there. There's a contact section with a form. You can just put your name and email in there and a little message saying, hey, I saw your video. I live in Timbuktu. I live in Azerbaijan. Can you help me? And we'll get right back to you, hopefully, with a good contact, good point of contact for a good chiropractor who's offering this more holistic, philosophical-based approach to your care. That care that says your God-given right is health, that he put it into our bodies, this intelligence to run our bodies. And all our job really is to free up that intelligence to let it get to work, factory reset to the body, allow it to function the way God intended it to when he made it. So hopefully that resonates with you. I hope that answers the questions of the people who've been sending these messages, which I really appreciate. That means our message is getting out. If you're looking for chiropractors to do this, it means that what we're talking about is resonating with you, and you're ready to make some big changes in how you take care of your health and how you view your health, which is awesome. That's the most rewarding thing we could possibly get out of doing these videos. So keep the questions coming. The means of communication, the channels are open. So feel free to get a hold of us. Again, like and subscribe to our channel. Share this with people. Get the word out there so that they can get the help they're looking forward to. We'll talk to you soon.